Vesiculobullous lesions. Introduction. A clear fluid lesion just below the epithelium which ruptures to form an ulcer. If this is smaller than 5 mm, then it is a vesicle. If this is larger than 5 mm, then it is a bulla. Classification. It's classified into intraepithelial and subepithelial vesicle. The lesion formed within the epithelium is intraepithelial. For example, pemphigus. Subepithelial. The lesion formed between the epithelium and the lamina propria. For example, pemphigoid, erythema multiforme, and epidermolysis. The variants of pemphigus are pemphigus vegetans, pemphigus foliaceus, erythematosus, and paraneoplastic pemphigus. Now we are going to see detail about the pemphigus vulgaris. A group of autoimmune blister disease of skin and the mucous membrane characterized by intraepidermal or intraepithelial vesicle or bulla formation. Epidemiology. There is a higher incidence at lower than higher altitudes. It has also been observed more frequently in certain peoples. For example, Ashkenazi Jews, Mediterranean populations, and Asians, especially Indians and Japanese, show some genetic predisposition. Pemphigus vulgaris. Autoimmune mucocutaneous disease that frequently appears first in the whole cavity and can progress to involve the other side. The associated factors are drugs like captopril, penicillamine, rifampicin, phenobarbital, and phenylbutazone, radiation and surgery, emotion stress and viruses, high levels of pesticide exposure, pregnant female diet, particularly garlic, and certain autoimmune disorders like rheumatoid arthritis, myasthenia gravis, and lupus erythematosus. Etiology. It is an autoimmune process in which IgG serum antibodies are produced against normal desmosomal adhesion molecules on the cell membrane of the keratinocyte. The normal epithelial adhesion molecules implicated are desmoglein 3 and to a lesser extent desmoglein 1, which belong to the cathedrin supergene family. The binding of antibodies to desmoglein at mucosal or cutaneous level gives rise to the loss of cell adhesion and separation of epithelial layers and consequent appearance of blisters on skin or mucus. Clinical features are the classic thin-walled bulla containing thin watery fluid developing on otherwise normal skin or mucosa. Bulla rapidly breaks, extends peripherally, leaving large areas denuded of the skin. When pressure is applied to the intact bulla, it enlarges by extension to an apparently normal surface. It does not heal and remain there for a few weeks to months. Nikolsky sign. When a pressure is applied to an apparently normal area, pulling away a layer of the skin from basal layer, and a new bulla formation takes place. All manifestation present as painful, fragile, fluid-filled blisters which may appear on any areas of the whole mucosa and burst within a few hours. As a result, clinical examination often only reveals shallow ulcers or erosions. The bulla is rapidly ruptured, leaving a collapsed roof of grayish membrane with a red ulcerated base. It's common in 4th to 5th decade of life. 80 to 90% present of the whole manifestation, and this proceeds 4 months before the skin lesion. Same-sex predilection most common occurs in buccal mucosa, parallel printing surface of tongue. Erosion formed in the oral cavity and esophageal mucosa, causing dysphagia. When the eruptions are widespread ulcerate abnormalities resulting from the loss of body fluid or hypoproteinemia are found. This can be fatal when there is secondary infection. Complications include thymoma. Now you can see the pemphigus occurring in the right buccal mucosa, right buccal vestibule, and gingiva. Diagnosis is based on independent set of criteria: clinical features, histology, and immunological tests. Presence of this disease must be suspected in case of persistent gingivostomatitis, persistent multiple oral lesions, or severe desquamative or erosion gingivitis. One diagnostic approach has been to press with a finger on the skin to test for the appearance of a new blister, that is the Nikolsky sign. Laboratory examination includes sand smear to detect acantholytic cells useful in lesions of the oral mucosa. Standard histology of fresh blister specimens to detect suprabasal acantholysis. Direct immunofluorescence to detect intercellular deposits of hemoglobin G, M, A, and C3 protein on epidermis and perilesional skin, offering 100% sensitivity. Indirect immunofluorescence to detect pemphigus antibodies in serum. ELISA test using recombinant desmoglein 1 and 3 to measure anti-desmoglein 1 and anti-desmoglein 3 antibodies in serum. Histopathological examination shows acantholysis in the suprabasal region, showing the hallmark of suprabasal split. Intraepithelial vesicle also shows sand cells. Connective tissue stroma showed loose collagenous stroma with dense inflammatory. Differential diagnosis can be erythema multiforme, acute herpetic gingivitis, impetigo, linear IgA disease, epidermolysis bullosa, cicatricial pemphigoid, bullous pemphigus, and paraneoplastic pemphigus. Treatment involves the systemic application of steroids as the first-line treatment. According to severity, 0.5 to 1 mg prednisolone per kg of body weight per day is administered. The dosage is tapered off to a maintenance dose or until it can be discontinued. Immunosuppressants like mycophenolate, mofetil, cyclophosphamide, azathioprine, methotrexate, and cyclosporine may be used. In intractable cases, plasma exchange therapy and megalobin therapy are also. The prognosis, the morbidity and the mortality of pemphigus related to the extent of the disease. The drug dose required to eradicate lesions, the age of the patient, the antibody titer, and the presence of the comorbidities. Before the introduction of corticosteroid, around 70% of patients die within the first year. Currently, less than 10% of patients die, usually due to secondary effects of the treatment. Various authors have reported that the oral lesion can disappear after 2 months to 1 year. Although it remains unclear whether the pemphigus completely remits, and there are no well-defined criteria for the cure or remission of this